So in this video, what we're going to do is we're going to talk about the skin pores created by microneedles and also how the skin recovers after a microarray patch is removed. And this is actually really important because what we want is a delivery system not only that's easy to use, that reproducibly penetrates the skin, but also that is pain-free and allows a fast skin recovery. So what we have here is a series of images where we use both optical microscopy and also optical coherence tomography to understand what happens when we actually insert a microneedle into the skin. So we know that this is something that's pain-free, but unless we use a technique like this where we can actually image into the skin, we can't really be sure how deep the microneedles would penetrate. Do they penetrate at all? And how might we measure then what actually is happening to the skin while the microneedles are in place, but also when we actually remove them from the skin? And so we can just see some examples here of the microneedles inserted in somebody's skin, and then the skin after the microneedles have been removed, indicating that yes, we are creating pores in the skin. The little micrograph here shows a patch in place under some occlusive film on a person's skin, and then looking at the mild erythema that quickly resolves on the surface of the skin after microneedles have actually been removed. So what we see in these series of images are some images of skin recovery after microneedles have been inserted in the skin. So at 45 minutes, you can still see many of the skin pores are still visible using optical coherence tomography. So they would not be visible to the naked eye, and we would probably have seen the transepidermal water loss, which is an important measure of skin barrier function, returning to normal much quicker even than 45 minutes. What we see in these series of images are the pores in the skin. So the stratum corneum may well have resealed here, but we still have an indentation of the stratum corneum, and that will slowly resolve over time, and we can actually follow that very nicely over a day using optical coherence tomography, where we see whenever we come along the next day that the skin appearance has pretty much returned to normal. And as I mentioned at the beginning, the true skin barrier has probably resolved within a matter of 15, maybe 30 minutes, depending on the microneedle design, but we can still see these indentations on the surface of the skin and actually measure those using optical coherence tomography. What we see here, and this is a new innovation for the Vivo site, are the vascular dynamics and how we can actually understand what is actually behaving and what is actually happening in the skin over time whenever we insert the microneedles from a vascular point of view. So these images show that yes, whenever we have a piece of skin, we'll be able to see that there are blood vessels that are clearly visible, and we can actually highlight those in red before we actually insert the microneedles. So after we insert the microneedles and then we remove them, clearly we see stronger vascular expression after the microneedle. So what that indicates is on a micron scale, we are causing some erythema. So an improvement in or an enhancement in blood flow relative to the fact that we've inserted something into the viable skin layers. And this increase in blood flow can be important in terms of enhancing, for example, drug absorption. And what is really important is that this increase in vascular expression, this increase in local blood flow or erythema, we can use optical coherence tomography to show that this resolves quite quickly, and that if we came along the next day, we wouldn't be able to see any erythema. So this is an important indication that microneedles are a safe delivery system, and actually we can use a quantitative technique to actually follow that. So here we see a series of summary images and actually some metrics here. So it shows the pores created in the skin by the microneedles, and it also shows then the improved blood flow or creation of erythema in the skin due to the fact that we're causing these tiny little micro insults across a particular area of the skin. And we can also then use optical coherence tomography to study this erythema as it actually resolves. So we can actually make measurements associated to the vascular changes associated with microneedle insertion, and then show that this erythema is short-lasting and it quickly resolves. So another important application of the technique, we obviously can do that in human volunteers in vivo. So this concludes this particular set of slides. In the next video, we will conclude with some thoughts about the future and taking the entire field of microneedles forward.